Hey guys, welcome back to my channel Physiosaurus. In this today's video, I'm going to talk about the ankle injury, specifically about the treatment part of ankle sprain. Okay, so in the previous video about the ankle sprain, we have discussed grades of ankle sprain, complications, lateral ligament sprain, medial ligament sprain, examination or the assessment, and in the end, we have discussed injury and the healing process after the ligament injury. All right. So in this video, we will talk about the treatment part as well as the symptoms of ankle sprain. So let's discuss symptoms first. Okay. So here, as you can see in this chart, this is about the clinical sign and symptoms that is associated with the stages of tissue healing. Okay. In the previous video, we have discussed tissue healing. All right. Now, there are three stages of tissue healing. First one is acute, then there is subacute, and then there is maturation stage. Symptoms, sign and symptoms, they actually differ, and they depends on what stage the injury is. For example, let's talk about the acute stage. So in acute stage, pain will be there at rest and it will increase during the weight bearing activity. Okay. The next one is tenderness to palpation, which is TTP in short. Then there is increased swelling, heat, protective guarding and muscle spasm, loss of function, restricted and painful range of motion, and then there is laxity with stress test. All right. Then there is subacute case, and in that subacute stage, there will be decreased pain. Once again, tenderness to palpation, swelling, heat, decreased spasm, and guarding. Okay, increased function. Then there is increased range of motion, with decreased pain, and then there is decreased laxity with stress test. So these are all the symptoms of subacute stage. And then there is maturation stage in which there is no sign and symptom of inflammation, okay, increased function and increased range of motion. So these are the sign and symptoms that are associated with the stages of tissue healing. About the stages of tissue healing, we have discussed it in the previous video. Okay, see, this is it. All right. Now let's talk about the clinical symptoms, sign and symptom that are associated with the grades of ankle sprain. So in the grade 1, there will be stretching of ligaments, usually the ATFL. Okay. Point tenderness, limited dysfunction. There is no laxity. Patient will be able to bear full weight and there is little to no edema. But in grade 2, there is partial tearing of ligaments, usually the ATFL and CFL. Point and diffused tenderness will be seen, moderate dysfunction, slight to moderate laxity. There will be antalgic pain and pain with full weight bearing. The patient may need supportive device to ambulate, that means to walk, okay? And there will be mild to very moderate edema. Then there is grade 3. Okay, so in grade 3, there is substantial tearing of the ligament and it may involve PTFL in addition with the ATFL and CFL. Once again, there will be a point and diffused tenderness, moderate to severe dysfunction. Okay. And the laxity will be also moderate to severe. Okay. And there will be limited to no ability for full weight bearing without the supportive device, and there will be severe edema. So this is the sign and symptoms according with the grades of ankle sprain. Now let's talk about the treatment part. Okay. So before starting with the goals and PT intervention, let's discuss the standard time which is required for the patient to return to the normal activity. However, it may differ, but still, okay. So for grade 1, the time taken to return to normal activity is 1 to 2 weeks. For grade 2, it is about 4 to 8 weeks, and for grade 3, it is about 12 to 16 weeks. All right. Now let's talk about the general goals irrespective of the grade 1, grade 2, and grade 3. Okay, so the general goals are: first one is protect from further injury, decrease pain, swelling, spasm. All right. Then re-establish the range of motion, flexibility, and tissue mobility. Re-establish neuromuscular control, muscle strength, endurance, power. All of these things. Then the second last is re-establish proprioception, coordination, and agility. And then the last one is re-establish the functional skills. So these are some of the general goals for a physiotherapist. So now let's talk about the goals for a physiotherapist according to the stages or phases. Okay. So the first phase is acute phase. So in acute phase, the general goals are to protect injured site from further injury, encourage tissue healing, limiting pain, swelling, spasm, maintain the function of non-injured tissues, and maintain overall conditioning of the body. For subacute phases, the goal is to prevent further injury, minimize pain and inflammation, promote tissue healing, restore range of motion and flexibility, and re-establish neuromuscular control and restore muscle strength and endurance. Along with that, re-establish proprioception, agility, and coordination. And the last one is maintain overall body conditioning. Now, for maturation phase or the maturation stage, the goal is to reduce the risk of injury, restore the range of motion and flexibility, improve muscle strength, endurance, and power. Then improve proprioception, agility, and coordination. And then improve functional or sport specific skills. And the last one is maintain overall body conditioning. See, guys, till now I have only discussed the goals, okay, but I have not discussed about the PT treatment part, but I'll discuss it. Okay, don't worry. Now let's talk about the return to sports criteria. How you would, comes to a certain conclusion that okay, now patient is able to return to the sports. Okay, so there are certain factors that you need to check. So the first one is pain-free activity. So the patient is able to do any activity pain-free. Second thing is ankle shouldn't be swollen. There should be fully functional range of motion of ankle joint, fully functional strength, endurance, and power. Okay, normal proprioception, balance, agility, and coordination to safely and effectively participate in activity. And then patient is psychologically ready to return to activity. So these are goals and return to sports criteria. Now let's talk about the PT treatment part, and that too phase wise. So the first one is acute phase. So if the goal is to protect from further injury, the method is rest, taping, taping or brace or splint, walking boot, all of these things, crunches or cane as needed, which is obviously needed for grade 2 and grade 3. If the goal is to encourage the tissue healing, the method is to rest, then again protection, pulsed ultrasound after 3 days. If the goal is to limit pain, swelling, and spasm, the method is rest, ice or cryotherapy, compression, electrical stimulation, ankle pumps with ankle in elevated position. Grade 1 joint mobilization can be performed after 3 days, then manual therapy techniques to address positional fault of talus or fibula, all of these things. If the goal is to maintain the function of non-injured tissue, the method is pain-free passive range of motion, active assisted range of motion, and then active range of motion should be performed. Ankle pumps, heel cord stretches, ABCs or alphabets can be performed in the cold whirlpool bath, towel curls, all of these things, toe pickups. Then partial weight bearing or full weight bearing as tolerated by the patient. If the goal is to maintain overall body conditioning, method is use a stationary bike, upper body ergometer, open kinetic chain, knee flexion and extension exercises, open kinetic chain, hip flexion, extension, abduction, adduction exercises, trunk exercises, upper extremity exercises, all of these things. Now, in subacute phase, to prevent further injury, method is to continue taping or bracing, gradually progress into rehabilitation and reconditioning activities. If the goal is to promote tissue healing, method is to introduce thermotherapy, that means hot packs, warm whirlpool baths, all of these things. If the method is, then the next method is ultrasound, progressing into continuous cycle. Massage, you can also give that. Flushing techniques in early stages, cross friction techniques in later stages. If the goal is to minimize pain and inflammation, method is cryotherapy, gradually introduce thermotherapy, which is hot packs, warm whirlpool baths, all of these things. So, once again, continuous ultrasound, electrical stimulation, grade 1 to 2 joint mobilization, and then once again, massage. If the goal is to restore the range of motion and flexibility, method is once again all of these things, So I'm just reading here because there is nothing much to explain. So what you can do is you can just take a screenshot of all of these things. However, I can give you the book reference too. So this chart is taken from Broadsman book. All right, Broadsman. and this book is uploaded in my Telegram channel. I'll just upload the link in my description box, and I'll also just pin it to the comment section as well, so you can just go and check that. Also, I'll just erase everything so that you can just take a screenshot. All right. So this is the PT treatment protocol for the ankle sprain. You can just take a screenshot for this and this. All right. Now here is the maturation phase. In the maturation phase is if the goal is to prevent re-injury, method is to continue taping or bracing. To restore joint range of motion and flexibility, more aggressive stretching is given. Okay. And then joint mobilizations are also given. To improve muscle strength, endurance, and power, method is to continue exercises from subacute stages, emphasizing on isotonic exercises, PNF, closed kinetic chain, all of these things. Plyometrics, functional exercises like jumping, running, changes of direction, all of these things. So, all of these exercises that you can do. If the goal is to restore functional or sports specific skills, so there are certain methods like four square hops, shuttle runs, CMO drill, shadow boxing, all of these things are, you can ask the patient to do that. Okay, so this is the PT treatment part for ankle sprain. So I hope you learned something from this video. In the next video, I'll talk about something else, something more interesting. So thank you so much, guys, for watching this video. Let's catch you up in the next video.